Hi everyone, and welcome to this month's clinical case. This month we're going to be talking about hyperthyroidism. So much in the same way that we've done in previous months, I'm going to quickly start off with an introduction. We'll talk about some of the key risk factors for hyperthyroidism. We'll talk about some of the causes, the way in which patients will present, the symptoms that they'll have. We'll talk about how you would go about investigating people presenting with the symptoms of hyperthyroidism as a clinician, and then we'll talk about the treatment and management of these patients before wrapping up with a key takeaway. So in the most broad outline, hyperthyroidism is when the thyroid gland, which is a gland that sits in your neck, essentially produces too much of the thyroid hormones. And there are two main thyroid hormones, T3 and T4. And hyperthyroidism is when there is too much of these two hormones. And what that does is that increases the metabolism of your body. So your body is effectively working much faster, and that's causing a whole host of symptoms that we will go on to talk about in a later slide. Okay, so I've mentioned that hyperthyroidism is when the thyroid gland is producing too much of the thyroid hormones. But how does this happen? And there are many different causes, and I've listed on this slide some of the key causes of this process. So one way in which this can happen is through an autoimmune condition. This is one of the most common causes of hyperthyroidism. It's probably one of the ones that you're most likely to encounter in clinical practice. There's an autoimmune condition called Graves' disease, and this can cause too much of the thyroid hormones to be circulating in your body. Another thing that can happen is there can be a tumor of the thyroid gland. And when this tumor, this lesion of the thyroid exists, it's called an adenoma, that can produce excess thyroid hormone. So there's effectively like this nodule, this thyroid, this tumor, and it's producing excess hormones. Another cause of hyperthyroidism is people who have hypothyroidism, so they have an underactive thyroid. They'll be taking medication for it, and if you take too much of that medication, obviously that can push you in the opposite direction. So you've got hypothyroidism, you're taking too much of the medication, and then you're getting the symptoms of hyperthyroidism. Okay, so those are the key, or some of the key causes. What are the risk factors for developing this condition? One of the most important risk factors is being of female sex. In fact, women or females are 10 times more likely than men to develop hyperthyroidism. Family history, as with many of the conditions that you have encountered in previous cases, is very relevant. If you've got family history, particularly of Graves' disease, you're much more likely to develop it. If you've got other autoimmune conditions, we spoke about Graves' disease being an autoimmune condition, you're much more likely or at risk of developing Graves' disease. And smoking, as with many other conditions in medicine, is also a risk factor. Okay, so someone's got hyperthyroidism, maybe it's caused by this tumor, maybe it's caused by an autoimmune condition, maybe it's caused by taking too much medication. Whatever the cause is, the symptoms tend to present relatively similarly, and there are a whole host of symptoms. It can affect all parts of the body in various different ways. The most common symptoms that people will report is feeling tired, feeling fatigued, feeling weak. They'll lose a lot of weight. Again, your body's overactive, your metabolism's too high, so you're losing weight. These patients will typically also be intolerant of heat, but they can also have other symptoms. They'll have palpitations, they'll have tremors of their hand, they'll have diarrhea, loose motions, frequent bowel movements, they'll be anxious, they'll be irritable. So as you can see, various parts of the body can be affected in many different ways, and it can have a really debilitating effect on one's life. Okay, so someone's come into the practice and you suspect that they've got hyperthyroidism. How would you go about confirming this diagnosis? One of the most important things to do, and probably one of the most obvious things you might think of, is doing blood tests and looking for thyroid markers in the blood test, looking for the function of the thyroid. So, for example, looking at those hormones, T3 and T4 that we spoke about in an earlier slide, seeing whether or not they are elevated in the blood. Obviously, if they are elevated, you would think this person potentially has hyperthyroidism. You can also look at things like inflammatory markers that tend to be raised in hyperthyroidism. In addition to these kinds of blood tests, you can do something called a radioactive iodine uptake test. So if the thyroid gland is taking up a lot of iodine, that again suggests that potentially it is hyperactive, that the person potentially has hyperthyroidism. And you can also do scans. You can do an ultrasound scan, and an ultrasound scan is a good way of detecting whether or not someone has a nodule, whether or not someone has one of those adenomas, those tumors. So a scan is a good way to see whether or not there are any abnormalities with the thyroid gland that could be causing the symptoms of hyperthyroidism. Okay, suppose you've done these investigations and you've confirmed your suspicion that the patient has hyperthyroidism and you've diagnosed them with it. How would you go about treating them? There are many different sort of aspects to the treatment, but the most important and the mainstay and the sort of first line thing you would do is treatment with medication. And there are two different types of medication that you'd give. One type of medication is more for symptom control. So we've spoken in an earlier slide how these patients will have things like palpitations, they will have tremors, and if you give beta blockers that are listed here on this slide, like propranolol, that can help to alleviate some of those symptoms, reduce the tremors, reduce some of the anxiety, reduce the palpitations, so that it treats the symptoms. And then there are other medication, another group or another class of medication called thionamides, like carbimazole, and this can help to actually relieve the underlying problem or address the underlying problem and reduce the levels of thyroid hormone in the body. So there's these two classes of medication that kind of work together to help patients. If the medication isn't really helping, you can give something called radioactive iodine, and this can potentially help in treating patients as well. If all of these options have not been successful, you can turn to a surgical intervention, and surgery could potentially remove the tumor, or it could remove any kind of nodules that may be causing the symptoms. So you've got medical treatment, and then potentially if that doesn't work, you can have surgical intervention to remove any causes of the symptoms. Now, the main takeaway from this case, I would say, is recognizing the role potentially for surgery. So very often patients won't be escalated to surgical intervention. They'll be started on medical treatment, on medication, like we spoke about in the previous slide. But if the medication isn't working, you always have to bear in mind that surgery may be necessary. Surgery may be indicated if the medical treatment has not been effective. And that wraps up this month's case on hyperthyroidism. Hopefully you've learned something new, something interesting. Again, it's something you'll absolutely encounter during your medical studies, but hopefully it's given you some insight into what hyperthyroidism is and how it affects people and how you'd go about investigating it and treating it in clinical practice. So that wraps up this month's case, as I said, and I look forward to presenting next month's case. Thank you.